Well, thanks very much. And as I was casually saying, it's really nice to see everyone in person. As everyone is aware, this fourth wave has been very challenging in many parts of the country, and in some places, community transmission of COVID-19 remains out of control, and hospitals are at or above capacity. And I know that many Canadians are really scared right now about what this means, not just for our healthcare systems, but for their own access to healthcare, their own pressing health emergencies. And we also know that Canadians are tired, and I think everybody wishes that the pandemic was over. And I certainly share those feelings, but as we've seen over the last year and a half, we have to keep going, and the best way to continue to fight the virus is to fight together and to stand together against the virus. Je veux assurer les Canadiens et Canadiennes que le gouvernement fédéral est là pour vous et que nous serons toujours là pour vous soutenir. Nous sommes en train de fournir de l'appui d'urgence aux régions du pays qui en ont besoin et nous sommes prêts à aider d'autres provinces et territoires si l'aide nous est demandée. Currently, the federal government is providing support to a number of areas of the country. In the Northwest Territories with RFAs that include the Canadian Red Cross and the Canadian Armed Forces assisting with health and human resources and in shelter operations. We're also in a number of provinces assisting with surge contact tracing support, and these are resources that can be accessed from StatsCan. We're providing funding for the operation of safe and voluntary isolation facilities in many sites across the country. And we are supporting with testing with the National Microbiology Lab and a few other federal labs that are helping with any surge capacity. And as has been previously reported, we are providing offers of assistance in our discussions with Saskatchewan and Alberta for health human resources, PPE, medical equipment, vaccines, testing, and anything else. As confirmed last night by my colleague Minister Blair, the Canadian Red Cross and Canadian Armed Forces will be assisting soon in Alberta, and I'm pleased to hear support from Newfoundland and Labrador will also be accepted. Officials in my department and over at Procurement Services Canada will continue to work with both provinces on their requests. As I indicated to my ministerial counterparts provincially, it's very important that we plan ahead for these challenging scenarios, as some types of help are easier to coordinate than others. For example, vaccines, test kits, personal protective equipment, medical equipment, and other things can usually be moved within 24 to 48 hours. But it's health and human resources. That's where the crunch really is, because of course these are people, and it takes time to figure out how we can move them around and get them to where they're needed. And the more time that we have to do that, the easier it is to deploy people if and when the time comes that they are necessary. So we all have a role to help with this fourth wave. And of course, the most effective way is to get vaccinated. If you haven't been vaccinated yet, or you have someone in your life who isn't vaccinated yet and is hesitant, please help make sure they get information that helps them make that choice to protect themselves, their families, and their communities. But we can also continue to follow the public health measures that we know are helping. To wear a mask when we're in gatherings, to avoid large gatherings or higher risk scenarios. And of course, if you're in an area where there is a high number of COVID cases, maybe it's time to not attend that outdoor gathering or indoor gathering. Maybe you make a decision to move an event to the outdoors to lower the risk. Every decision that we make right now can reduce the risk, stop transmission of cases, and it does make a difference. Thank you also to the 81% of eligible Canadians who have already been vaccinated. Globally, we have shown the progress that Canada has made on this front, but of course, we still have a large number of people who have not been vaccinated and who cannot be vaccinated. So again, if you are one of the folks that has not yet taken advantage of this life-saving medication, please do so. If not for your health, think of the teachers, the mental health of school children who are so desperate to continue to stay in class this year, or the small business in your community that just can't afford to even fathom another period of inactivity. The faster and the more that we get vaccinated, the faster we can defeat this fourth wave. I know many of you are also eager to know when vaccines might be available for those under 12. We're waiting right now for the companies to submit applications for the 5 to 11-year-olds. And once the application is received, Health Canada is in a very good position to quickly proceed with its thorough review. And so to parents, I know it's been an extremely challenging time. Many parents are still working from home, still homeschooling, providing full-time daycare while also holding down a job, worrying about your own mental health, your children's mental health. And I want to recognize the extra burden that the pandemic has placed on you and your family, and to thank you for everything that you're doing to protect yourself and your communities and your families. Finally, we all owe a huge debt of gratitude to the frontline workers. The doctors, the nurses, the paramedics, the social workers, the respiratory technologists, and so many more, the medical professionals who are dealing with what is likely the most challenging time of their professional careers. And I can confidently say on behalf of all Canadians, we're extremely grateful for your dedication, for your commitment, for your compassion, and for keeping all of our healthcare systems running and supporting the well-being of all Canadians. So thank you, merci, miigwech. And I'll take your questions.
All right. Thank you very much, Minister. We'll start. Nous commençons avec 3 questions par téléphone et après ça, 3 questions dans la salle ici. We'll hand it over to the operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Sharon Kirky, National Post. Please go ahead. À vous la parole.
Oh, hi. Thanks so much for taking my question. Minister, Alberta and Saskatchewan this week requested doses of the Janssen vaccine in the hope that it would increase vaccination uptake among those who do not want an mRNA vaccine. Should this option not be available to other Canadians? I'm wondering your views on that.
Well, thank you for the question, and we are working right now on those requests and have also offered an option to all provinces and territories who are interested in acquiring doses of Johnson & Johnson. We will be trying to provide those doses as quickly as possible to the provinces that are currently seeking them. But as I said, the department right now is scanning with all the provinces and territories to see if there's a demand in other regions of the country.
Okay, and one other question, if I may, and it's around the children and the Pfizer vaccine for those under 12. You did mention that, you will be reviewing this and proceeding, but, we're hearing reports that it could be approved for children in the U.S. Within the coming weeks, which means children in the U.S. could be start getting vaccinated by Halloween. Yet it could be, end of year, early 2022 for Canada. I'm wondering why there could be such a delay here.
I'm not sure I have the same information as you. We do anticipate that we'll have an application in the weeks to come from at least one of the two companies. And as soon as that application comes in, the regulators are well situated to very quickly review those applications. We've added millions of dollars to the regulatory body so that there are additional scientists and analysts that can and that do work on a 24-hour, 7-day-a-week basis. So we're very well situated, as I said, and those conversations with the corporations are ongoing right now. So we'll have to wait and see how quickly the company applies to Canada. Certainly, I know those conversations are happening, and when they do, we'll be able to quickly review the data and approve when thoroughly demonstrated as safe.
Thank you, operator. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, merci beaucoup. Hi, Minister Hajdu. the Prime Minister this week put out 5 key priorities in terms of vaccination. I was wondering if we could get a sense of how quickly the government is committed to implement mandatory vaccination for the public service, but also passengers on trains and planes. And when are we going to have more specifics on how this is going to work?
Well, thank you. And I share the Prime Minister's urgency in those objectives. And I'll say that I know those conversations are happening right now in terms of the federal public service with obviously the employers, but also the unions to make sure this happens in the right way. And in terms of passports or proof of vaccination for domestic travel, my understanding is that Transport feels this will be possible by the end of October. So we're moving as quickly as we can on both fronts. Again, to provide people safe workplaces and to provide safety for individuals that are traveling within Canada.
Any idea when we would have specifics? I think the Prime Minister was talking about the next few days, but if ever we have more information on that, that would be appreciated. My second question was, about the cabinet that's going to be announced in the next few weeks. I was just wondering if you were hoping to stay on as Health Minister.
Well, thank you very much for the question. It's, first of all, just been an honor to serve with Prime Minister Trudeau for the past 6 years in his cabinet, and I will serve this country in any way that he asks me to do so. It continues to be a privilege to be a member of Parliament and to be a Minister of the Crown.
Okay, thank you, Operator. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Zach Vishera, Saskatoon Star Phoenix. Please go ahead, à vous la parole.
Thank you very much for taking my question. Minister, I know that you had a conversation with Minister Paul Merriman in Saskatchewan about a potential request for federal aid last week. I understand that Premier Scott Moe also spoke to the Prime Minister about what Saskatchewan might need earlier this week. I'm wondering if you've received any more specifics from Saskatchewan on what they may require to deal with a rising COVID-19 hospitalization rates, and if an official RFA, a request for assistance, has indeed come in at this point.
Well, thank you for the question, Scott. So far, we have not received an official request for assistance from Saskatchewan, although Minister Merriman and I did have a conversation about some of the requests that the province likely will have. We do know that he's asked, for example, for additional monoclonal antibodies, and they have some already, so we're working on the details of what that further need might be. Certainly, a request for assistance will help clarify more quickly exactly what the province is looking for and how we can best help them meet those needs.
Thank you. And a follow-up, if I may, on those monoclonal antibodies. The Premier and the Health Minister in his letter to you were quite bullish on those and said they wanted to see those used much more widely in Saskatchewan. Similar to what is happening in the United States was the analogy, the comparison the Premier used. I'm wondering if Health Canada has an adequate supply of these antibodies to do that. I understand they're expensive. And I'd also like to know if there are any cautions around their use. I understand they're recommended right now for a very select group of patients.
Well, I think the questions around the appropriate use of the treatment would be best left for Dr. Tam, and she'll be here after me. So I'll leave those questions to her around the appropriateness of use and when. But I will say in terms of the supply, we do have a supply in Canada. We also know that Saskatchewan has a supply. And again, once we understand the degree to which they propose to use these antibodies and the timeline, we'll have a better sense of how we can meet the need.
Okay, thank you. And I will take questions in the room if we can alternate the two microphones. I don't know who is in first, but we'll start over there and come over here.
Hi there, Minister. Travis Stanraj, CBC News. Thank you for taking our questions today. Minister, I just got an email from the Chilliwack Progress. This is just published in the Chilliwack Progress. It's a picture of the Prime Minister relaxing on a patio yesterday with a beer next to him. Many Indigenous people are outraged the Prime Minister traveled to the beach in Tofino to be with his family on the first National Truth and Reconciliation Day, rather than, for example, accepting an invitation to visit Kamloops, which he flew past. What's your reaction about the message that sent to Canadians, specifically Indigenous Canadians?
Well, all I can speak to is my experience yesterday, and it was truly a profound experience. Of course, I have heard many times before, especially in my riding of Thunder Bay Superior North, stories of people who are residential school survivors. But on this first national day of truth and reconciliation, to see the community come together in such a large way to listen to the stories of Indigenous people and to commemorate, in our case, the site of a former residential school, to listen to the chiefs and the various individuals and elders share their story was very, very moving, and it was an honor to participate. And so for me, this day will have a profound legacy for Canadians and for Canada. And I think of the words of the newly sworn in Governor General, Mary Simon, who reminded us all that reconciliation is indeed a journey, and that what we're doing as a country and as Canadians right now are planting the seeds of a garden for our children. And I thought it was the most beautiful way to summarize what this National Day hopefully will become for Canadians.
Thank you for that, Minister. You didn't address the core of the question about your reaction to the Prime Minister being on a beach in Tofino, but I do have to ask you about something else, and that is the Merck pill that has been, they've requested it for emergency authorization in the United States. I know that that's in the approval process right now with Health Canada, but would Health Canada consider emergency use of this pill for COVID-19?
So we have a very different process of approvals than the United States, who has an emergency approval rather than a rolling regulatory approval process that we implemented at the beginning of the pandemic. So, for example, you may have heard in the U.S. the debate about emergency use authorization of vaccines and other medications versus permanent use authorizations. We don't have that distinction here in terms of the ways that we've been doing approvals. The best person to speak to about this, though, in detail would be Dr. Sharma, who will come on afterwards and is the head of our regulatory body. And I'll just say that, again, the regulatory body of Health Canada is extremely well positioned to do very rapid rolling reviews. And they don't stop once the approval is received. There's an ongoing data and safety check that allows for Health Canada to be able to change, for example, instructions of use, or in worst case scenario, revoke use for specific medications or devices. So I'll let Dr. Sharma add more detail when she speaks with you.
David Aiken, Global News. Congratulations on your re-election, Minister.
David.
I want to pick up on something Travis talked about. I noted you yesterday, many cabinet colleagues, participated in a reconciliation event as you probably wanted to walk down the path of reconciliation and the Prime Minister wanted to walk down a beach. Does that not set back efforts to reconcile when Indigenous leaders look at the Prime Minister and they don't see him setting example that you and your cabinet colleagues set?
Well, I think what's I heard from the Indigenous people that I spoke with, including former Grand Chief Alvin Fiddler, as you know, and Deputy Grand Chief Annabette Ashni-Pineskam, and many other Indigenous leaders that were at the event yesterday in Thunder Bay, Ontario, was the historic enormity of a day that recognizes the ongoing colonization that Indigenous people face. It was obviously focused heavily yesterday on the experience of residential school survivors and their families and the historical sort of trauma. But I think there's a broader acknowledgement that it's also about the ongoing ways that Canada perpetrates that trauma on Indigenous people. And so for me, it's hard to put into words how moving that day was and how moving it was to see so many citizens out meeting with Indigenous people and hearing stories that I know for sure some have never heard before. And to me, that is reconciliation. It's relationships. It's not one day. It's not a T-shirt. All of those things help to raise awareness. But I said this in the campaign, and I truly mean it. And I said it yesterday in my remarks, that reconciliation is just a word if it's not built on relationships. And that the best way to reconcile and to begin to reconcile is to get to know the Indigenous people in your own community, one by one, family to family, colleague to colleague. And so I'm really, really proud to be part of a government that has helped with so many opportunities for Canadians to do that.
Probably a lot of people agree with you. And I think I know the answer I think I know what you might say, but I'm going to rephrase the question. It was a statutory holiday. You could have taken the day off. You could have taken the day off, as some in your cabinet did, one particular person, but you chose not to take the day off. Why did you decide not to take the day off yesterday?
Well, I can't speak to other people's scheduling. I know the Prime Minister was at an event the evening before with survivors, but I honestly don't have the details of his schedule. I can just speak to mine, as I have, which is that I was invited to an event. I was able to attend, and it was an honor to be there. It's an honor, and it's an interesting opportunity as an elected official to meet with Indigenous people in our communities, as I know the Prime Minister does, by the way, all across the country, to hear what more we need to do as a country. And there is so much more that we need to do. And so to all Indigenous people across the country who shared their personal stories and wept and allowed themselves to be vulnerable, to share those incredibly painful stories, thank you. Thank you. I saw you. I saw you on TV. I saw you in person. And I personally know that this journey is just beginning.
Kevin Gallagher, CTV National News. Minister, as you mentioned, we're grappling with a fourth wave, and in many parts of the country, it's heading worse than others. In Saskatchewan, Alberta, and British Columbia, they're asking for more of the Janssen vaccine. I know you were asked about this earlier. How many doses does Canada have on reserve? And is this the type of strategy you think that is necessary now? If there is vaccine hesitancy for mRNA, is that the right way to combat it, by offering some people a different vaccine?
Well, for part two of the question, I'll just say we've always said that we'll be there for provinces and territories with the tools that they determine that they need in their fight against COVID-19. Obviously, this is a medical decision, and I know that Dr. Hinshaw will have guidance. I know that Dr. Tam is working closely with her colleagues, her Chief Public Health Officer colleagues across the country. And so I will trust in the decision of the scientists and the doctors who will make those difficult decisions. And in terms of whether or not we have doses on hand, currently we don't have usable doses on hand, and so we're looking for additional doses so that we can get them very quickly to the provinces and territories, although we do have contractual offers, as you know, with the corporation.
The fact that Canada doesn't have usable doses, is that because of, just maybe remind me, because I'm trying to trace it all. There was the issue with the factory in Baltimore, right, the production facility. Why do we not have usable doses now? Because, as you mentioned, Canada does have a contract with Johnson & Johnson to have a certain amount. So perhaps you could enlighten me as to why we don't have those doses now when provinces say they need them.
Well, first of all, the regulators will never approve a product to come into Canada until they're completely safe for use. And so, as you know, the regulatory process is not just the vaccine itself, but also where the vaccine is manufactured, right down to the various lots and batches of vaccines, and that work is underway right now. There are a number of options, and I believe my colleague, Minister Anand, could speak more clearly about all those options, but there are other plants and options that we're exploring as we speak in terms of where we can access doses. And as I said, we'll be working on this very quickly so we can get them as quickly as possible to the provinces that wish to use them.
All right, thank you. We'll take, we'll do two more questions on the phone and then two questions in person if we can. Operator, over to you.
Thank you. Merci. The next question is from La prochaine question est de Louis Blouin, Radio-Canada. Please go ahead. À vous la parole.
Bonjour, Madame la Ministre. I want to ask you about a mandatory vaccination of the public servants. In your view, for mandatory vaccination to be efficient, should a proof of vaccination be requested?
If I understand the question correctly, you're asking if a proof of vaccination should be requested for a mandatory vaccination program. Did I understand that correctly?
Yes, exactly. Is that for the mandatory vaccination to be efficient, should a proof of vaccination be requested?
I think we're, listen, I think, Louis, thank you for the question. I think the operational details will vary from office to office. I can't really speak to that. I'm not involved in the design of the operational details. As you know, different places have different sizes of offices. For example, in our office, my small office in my constituency team, there's about 10 people. They've all shown their proof of vaccination, which I have asked for as an employer, and now they have, and I don't need to request it again. So I think it is an operational detail that we can certainly come back to you on.
Okay, next question about the third doses. Some provinces, as Quebec, suggested that there would be a third dose for older people. NACI recommends a third dose only for immunosuppressed people. Do you think this definition or recommendation should be, widened? Do you think that could be coming?
That would be a good question for Dr. Tam, who will come on just after me. As you know, my job as the Minister of Health is not to second guess the professionals and medical experts that are making those decisions, but to enable them to make them as quickly as possible with resources, whether it be money or people or other resources that they need to make those decisions. We've always said that it is science that will lead the way. And so from our perspective at the federal government, we support the work of NACI. We support the work of the Public Health Agency of Canada, but I would encourage you to ask Dr. Tam that question because she may be able to shed more light on it.
Okay, thank you. Operator, next question.
Thank you. Merci. The next question is from La prochaine question est de Ryan Tumulty, National Post. Please go ahead. À vous la parole.
Yeah, Minister, earlier this year and before you've suggested that there will be some manner of review of the government's performance during COVID. I'm wondering if you can give us more details now that the election's over and behind us about what shape that review might take and when will it move forward.
Well, thank you, Ryan, and you're right. I've been really clear that I not only hope that there's a review, I would expect that all countries do a formal review of their pandemic response. I think we've all had a lot of lessons that we've learned, and there are a lot of things that we could, as a nation, but certainly as a globe, do better in any other health threat that we will undoubtedly face as a world and as a country. In terms of details about how that might unfold, there have been a number of reviews already. As you know, the GFIN, the Global Public Health Information Network, underwent an independent review, and there's a report on how to bolster GFIN here. Those kinds of things, I think, are pieces of what I believe we need to do, which is a national review. And I really can't speak to the timeline. As you know, we've just been re-elected as a government, and so I will be working with my colleagues to determine how that is most appropriately done.
Yeah, and just on the situation in Alberta and Saskatchewan, you talked today about the federal resources that you're providing, but there's a lot of concern that Alberta is not doing enough to limit the number of new COVID patients that it is seeing. Obviously, federal resources are finite. You can only offer so much help to them. Are you concerned that the Alberta government isn't doing enough to ensure new patients don't just keep flooding into ICU wards?
As the federal health minister who has been on this file for the last year and a half, almost 2 years, I would say that case growth is always concerning. That when we see people getting sick in high volumes, we know that means that a certain percentage of those people will become hospitalized, and yet another percentage of those people will become so severely ill they need ICU, intensive care unit resources, and then of those, some people will sadly die. So I think we all need to be doing what we can do to reduce the spread of COVID-19, and we have the tools at hand now. We know what works, and we know that the sooner that we can reduce that spread, the sooner we can put out the flames of COVID-19 in these outbreaks. So that is why my remarks at the top of this press conference really stressed to Canadians, and particular Canadians in areas with high COVID transmission not to take the virus lightly, even those people who are vaccinated, to be careful, because of course there's a higher risk even for vaccinated people. If there's a lot of COVID in your community, then there is an elevated risk even for vaccinated individuals. The goal is really to have as little COVID as possible in our communities. Some people would say we should have no COVID. Perhaps that is achievable, but I do know that working together we can keep those case numbers down. And I want to give a special acknowledgement to the Thunder Bay District Health Unit, my own health unit, who has achieved a 90% first dose, 83% second dose, maybe it's higher now, immunization rate, which has really, really helped, but also the ongoing cautiousness around public health measures to make sure that people are continually communicating how to reduce those risks. And it really is on all of us. We have to act together. This virus exploits the differences amongst us. It's an opportunity, if we act together, to reduce those numbers, which, by the way, are actually people that are getting sick. And finally, I'll just say this. You know, it's scary to think that the highest case growth rate is in the 0 to 19 age category. So think about that. The people that are the most likely to get sick right now are our children. So we do need to do everything within our power individually to protect the kids in our communities.
Merci. Nous avons deux questions ici dans la salle et après ça, le temps pour une dernière question par téléphone. Christy, over to you.
Hi, Christy Kirkup with the Globe and Mail. Just respectfully to go back to the Tofino situation for a second, why can't you say anything about the Prime Minister's decision to do what he did yesterday?
Well, I think I have answered the question. And I think that, again, I think that to talk about yesterday, the most important piece of yesterday was the voices of Indigenous survivors. I'll just bring us back to the stories that were shared and the incredible coverage throughout the national media of Indigenous voices and the number of people that stepped up from communities across the country to listen to those voices. That's the importance of yesterday. And I don't want it to get lost. I want to make sure that when we talk about the National Truth and Reconciliation Day, that we're honoring the voices of Indigenous people. That's what it was about. It was about listening to the voices of Indigenous people, reflecting on the trauma that Indigenous people have faced in this country since contact and continue to face in many respects. And I want to make sure that those voices are heard first and foremost.
Respectfully, Minister, the reason that I'm asking you this question about what the Prime Minister did is because he took a decision to take a trip to Tofino, and some people, including Indigenous leaders and experts, are saying that this is drowning out the voice of Indigenous leaders and survivors on what was a very solemn and important day for the country. So does that make your job as a government harder, the signal that this sends to Canadians about the commitment to reconciliation?
Well, what I saw in my community was a commitment to reconciliation. The number of people that were at the events, the number of people that shared their own personal stories, including Indigenous people, the reckoning that so many communities are having around the impact of a colonial history that has been so damaging to Indigenous people. It's our first ever National Truth and Reconciliation Day, and it is a legacy. It's a legacy for this country. And again, I think the person that said it the best was the Governor General when she said, we are planting the seeds of the garden for our children and grandchildren. I can't think of a more beautiful way to describe what this work is all about.
Hi, Minister. Mike Blanchfield, Canadian Press. Following on your comments about children and risk earlier, why haven't the companies submitted their data to Health Canada yet? I mean, are you concerned about a delay in that? Is it because the government wants more information or a higher data sample or something else? Can you elaborate on that a little bit?
Those questions will be probably best put to Dr. Sharma, who will be here shortly, but my understanding is it's not a delay of data or any kind of snafu, if you will, with the companies. There are ongoing conversations with the companies, and we anticipate we'll get that submission in the very near future.
And now that 80% of people over 40 are fully vaccinated, and there's been a large uptake in 18 to 39-year-olds, what can the government do to target younger people who aren't getting vaccinated? And at what point can you say you've come far enough?
Right. Well, of course, you know, the more of us that are vaccinated, the less foothold the virus has to infect people who are unprotected through lack of vaccination. And so for me, obviously we want to get as many people as protected as possible. In terms of what we can do, we've been a partner to provinces and territories, as you know, on vaccination, not only through the purchase and acquiring of vaccines and distributing them to provinces and territories and making sure that that's available without any worry about the financial aspect of that. So this federal government continues to do that, really on all equipment, by the way, PPE, therapeutics, medical equipment. But we also have run ongoing media campaigns. We've funded innovation challenges for not-for-profit groups that work with a variety of different segments of our communities, whether it be unionized workers, multicultural groups, people with language barriers or other barriers. And we'll continue to be there to partner with provinces and territories so that they can get the job done.
Okay, and we have time for one last question on the phone. Operator?
Thank you. Merci. The next question is from, la prochaine question est de Jamie Moricher from Global News. Please go ahead. À vous la parole.
Hi, Minister. Thanks so much for taking my question. I just have two quick ones. One being, are you able to tell me exactly when Alberta can expect that human resources help? I know you said 24 hours for PPE and stuff like that, but a little longer when you're sending people.
Yeah, we're working right now with Alberta on the details of exactly what kinds of professionals they need and where. So as soon as we have the granular details through the RFA process worked out, then we'll be able to begin to deploy.
Are we talking a week or less than?
It depends on the details from Alberta. We are waiting to hear who they need and where and what kinds of professionals. And as soon as we have that detail, we'll begin to put together the plan on how to get them to the province very quickly.
Okay, and then my follow-up to you is back in August, the Premier of Alberta said that he didn't need a lecture from you when it came to handling COVID-19. He's kind of pushed off help from the federal government up until accepting it yesterday. At this point, the province is kind of past the tipping point, according to frontline workers. Do you wish, or is there a way, I guess, that the federal government could have stepped in a little bit sooner? And are we waiting for things to get worse in Saskatchewan, or, you know, it's kind of on the same trend where we're putting off the ask for help until what?
Well, the letter was sent because, of course, from the people that advised me at the Public Health Agency of Canada, there was a high degree of concern around the measures that Alberta was proposing dropping at the time. And there was modeling that showed by Dr. Tam and the Public Health Agency of Canada that if we, even with vaccination, released measures too quickly, we would see a resurgence. And that's exactly what we have seen. In terms of the requests for assistance, I can't speak to their processes. I can say that the offer has been ongoing. Even during the election, the officials were working every day with the officials from provinces and territories to make sure that they knew those requests could come in at any time and that we would work to fulfill them. And that's exactly what we're doing with these requests. So all I'll say is that the reality is that we have to follow the science, that the virus doesn't respond to what we wish it would do. It is the case growth is unavoidable if we don't take the appropriate measures. And when I say case growth, I want to remind everybody that these aren't cases. These are people. These are now people's children, people's fathers and mothers. It is skewing younger, of course, because we do have such a high rate of vaccination in elders. And so we need to do everything we can together, provinces, territories, the federal government, and individual Canadians to protect each other so that we can get through this, get more people vaccinated, and finish the fight against COVID-19. Thank you.
All right, thank you, Minister. Thank you, media, for your questions. This concludes today's press conference.
Hello, everyone. Bonjour à tous. Welcome to today's portion of the update on COVID-19 with the Government of Canada officials. Bonjour et bienvenue à la partie de la mise à jour au sujet de la COVID-19 avec des fonctionnaires fédéraux. We will now hear remarks from Canada's Chief and Deputy Chief Public Health Officers, Dr. Theresa Tam and Howard Njoo. Today, they are accompanied by Health Canada's Chief Medical Advisor, Dr. Supriya Sharma. As usual, the doctors will be available for question afterward. Nous entendrons maintenant des allocutions des Dr. Theresa Tam et Howard Njoo de l'Agence de la santé publique du Canada. Ils seront accompagnés par la conseillère médicale en chef de Santé Canada, la Dr. Supriya Sharma. Les docteurs seront disponibles pour des questions après leurs allocutions. I remind you that if you wish to ask questions, please press *1 on your phone. Si vous désirez poser une question, appuyez sur *1. Let's begin today's update. Over to you, Dr. Tam.
Thank you for that introduction. Bonjour à toutes et à tous. Today is National Seniors Day, reminding us of the important contribution of elders in our lives and how we can give back every day with our time, companionship, and support. The latest surveillance data show ongoing regional variation in COVID disease activity, but overall, epidemic growth appears to be fairly stable nationally. Over the past week, there were an average of over 4,350 new cases being reported daily across Canada. However, severe illness trends are still increasing, with an average of more than 2,400 people with COVID-19 being treated in our hospitals each day, including almost 800 in intensive care units, and 38 deaths were reported daily. COVID-19 cases and hospitalizations are predominantly occurring among unvaccinated people. From mid-August to early September, the average weekly rate of new COVID-19 cases was 10 times higher, while the average weekly rate of hospitalizations was 38 times higher in unvaccinated people than in fully vaccinated people. Although very high vaccination coverage is needed to offset the highly contagious Delta variant, COVID-19 vaccines are making substantial contribution to population protection. Where vaccination coverage is lower and rapid epidemic growth is occurring, public health measures are crucial to rapidly reduce contact rates that fuel virus spread. Administering vaccines and building up immunity across the population takes time, but reducing the pool of susceptible people through vaccination is also vitally important for preventing severe and/or potential long-term complications of COVID-19 infection that puts pressure across the health system. Increasing vaccination coverage quickly can also help reduce the duration and overall impact of the Delta wave on healthcare, schools, businesses, and other essential services. Experience the world over has shown that what works best is a combined approach of achieving high vaccine coverage, making indoor spaces safer through improved ventilation, and individual layers of protection, such as masking and spacing, and reapplying public health measures to slow the spread and minimize serious illness where the virus is surging. This week, Canada's National Advisory Committee on Immunization released updated guidance recommending an mRNA COVID-19 vaccine booster dose be given to residents in long-term care and seniors in other congregate settings who are at higher risk of exposure and serious illness. NACI is also advising that COVID-19 vaccines may be given at the same time as or any time before or after other vaccines. This is great news and means that COVID-19 vaccines can be co-administered with other vaccines. This will make it easier for people to get their influenza vaccine this fall, as well as catch up with other routine vaccines that may have been delayed during the pandemic. Thanks to the added protection of COVID-19 vaccines, this is the first time since the pandemic began that we will gather in larger numbers indoors this fall and winter. While our protection against COVID-19 has been bolstered by vaccines, we also need to think about the return of other respiratory infections. In addition to getting up to date with recommended vaccines such as influenza and other routine vaccines for children and adults, we can stay healthier by keeping up with hand and cough hygiene practices, getting the best ventilation possible in our indoor spaces, and staying home and away from others if we develop symptoms. Finally, I'd like to end by acknowledging that yesterday was the first National Day for Truth and Reconciliation. Going forward, we can continue to honor those who were lost and show compassion for survivors by listening, learning, and striving to understand the ongoing impacts of residential schools on First Nations, Inuit, and Métis people and communities. There are many learning resources on the National Day for Truth and Reconciliation website, which I will link to from our remarks posted online. Thank you. Merci, Megwidge.
Bonjour à toutes et à tous. Aujourd'hui est la Journée nationale des aînés. Cette journée vise à nous rappeler combien les aînés jouent un rôle important dans nos vies et à nous montrer comment nous pouvons leur rendre l'appareil chaque jour en leur consacrant du temps, en les accompagnant et en les soutenant. Selon les plus récentes données de surveillance, l'activité de la maladie continue de varier d'une région à l'autre. Mais en général, la croissance de l'épidémie semble relativement stable à l'échelle du pays. Au cours de la dernière semaine, plus de 4 350 nouveaux cas ont été signalés en moyenne chaque jour au Canada. Cependant, les tendances relatives aux cas graves continuent d'augmenter. En moyenne, chaque jour, plus de 2 400 personnes atteintes de la COVID-19 sont soignées dans nos hôpitaux, dont près de 800 dans les unités de soins intensifs et 38 décès sont signalés. Les cas de COVID-19, les hospitalisations surviennent principalement chez les personnes non vaccinées. De la mi-août au début de septembre, le taux hebdomadaire moyen de nouveaux cas de COVID-19 était 10 fois plus élevé et le taux hebdomadaire moyen d'hospitalisation était 38 fois plus élevé chez les personnes non vaccinées que chez les personnes entièrement vaccinées. Si une couverture vaccinale très élevée est nécessaire pour faire échec au variant Delta, qui est hautement contagieux, les vaccins contre la COVID-19 contribuent largement à la protection de la population. Dans les régions où la couverture vaccinale est plus faible et où il y a une croissance rapide de l'épidémie, il est essentiel de prendre des mesures de santé publique pour réduire rapidement les taux de contact qui favorisent la propagation du virus. La vaccination et le renforcement de l'immunité de la population prennent du temps. Or, il y a d'une importance capitale de réduire le nombre de personnes vulnérables en recourant à la vaccination pour prévenir les complications graves ou de longue durée liées à la COVID-19 qui exercent des pressions sur le système de santé. De plus, l'augmentation rapide de la couverture vaccinale peut également contribuer à réduire la durée de la vague causée par le variant Delta et ses répercussions globales sur les soins de santé, les écoles, les entreprises et d'autres services essentiels. D'après l'expérience acquise dans le monde entier, l'approche la plus efficace consiste à combiner une couverture vaccinale élevée avec l'amélioration de la sécurité des espaces intérieurs grâce à une meilleure ventilation de ceux-ci et l'application de mesures de protection individuelles comme le port de masque et la distanciation et la remise en place de mesures de santé publique visant à ralentir la propagation et à limiter les cas de maladies graves en cas de recrudescence du virus. Cette semaine, le Comité consultatif national de l'immunisation, ou CCNI, du Canada, a publié des lignes directrices actualisées recommandant l'administration d'une dose de rappel de vaccin ARN messager contre la COVID-19 aux résidents des établissements de soins de longue durée et aux personnes âgées vivant dans d'autres établissements collectifs qui présentent un risque plus élevé d'exposition et de maladies graves. De plus, le CCNI a indiqué que les vaccins contre la COVID-19 peuvent être administrés en même temps que d'autres vaccins ou à tout moment avant ou après leur administration. C'est une excellente nouvelle. Cela signifie que les vaccins contre la COVID-19 peuvent être administrés conjointement avec d'autres vaccins. Il sera donc plus facile pour les gens de se faire vacciner contre la grippe cet automne et de recevoir tout autre vaccin prévu au calendrier de vaccination qui n'aurait pas été administré pendant la pandémie. Pour la première fois depuis le début de la pandémie, nous pourrons nous rassembler en plus grand nombre à l'intérieur cet automne et cet hiver grâce à la protection accrue qui confère les vaccins contre la COVID-19. Toutefois, si les vaccins ont amélioré notre protection contre la COVID-19, nous ne devons pas oublier que d'autres infections respiratoires font leur retour. En plus de recevoir les vaccins recommandés, comme le vaccin contre la grippe, et ceux qui sont prévus au calendrier de vaccination pour les enfants et les adultes, il convient de prendre d'autres mesures pour rester en bonne santé, comme se laver les mains, tousser dans les creux du bras, optimiser la ventilation des espaces intérieurs et rester à la maison et à l'écart des autres si nous développons des symptômes. En terminant, j'aimerais souligner qu'hier était la première journée nationale de la vérité et de la réconciliation. Grâce à cette journée annuelle, nous pourrons à l'avenir rendre hommage aux disparus et faire preuve de compassion à l'égard des survivants en écoutant leurs récits, en enrichissant nos connaissances et en nous efforçant de comprendre les répercussions des pensionnats sur les peuples et les collectivités des Premières Nations, des Inuits et des Métis. De nombreuses ressources d'apprentissage sont proposées sur le site web de la Journée nationale de la vérité et de la réconciliation. Vous trouverez un lien vers ces ressources dans les versions texte de notre allocution affichée en ligne. Merci. Thank you, Miigwech.
Merci, Dr. Njoo and Dr. Tam. Thank you. We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. As usual, we'll be taking questions in both official languages. Donc, nous allons prendre vos questions au téléphone. Nous vous demandons de vous limiter à une question et seulement une question de suivi. Vous pouvez poser vos questions dans l'une des deux langues officielles. Operator, first question. Opérateur, première question, s'il vous plaît.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Ryan Tumulty, National Post. Please go ahead, à vous la parole.
Yeah, hi there. I guess this question is probably best for Dr. Tam, but I'm wondering on vaccine hesitancy. The government is taking, I guess, some sort of stick approaches by imposing mandates and things like that. I'm wondering, what PHAC is doing on the carrot side, and maybe from previous campaigns, what you have known works and doesn't work when it comes to getting people to get vaccinated.
Yes, thank you for that question. And I'd point out that I was really happy to see that there's been a jump in first dose uptake in Alberta and in Saskatchewan, for example. So some of the latest action collectively by different levels of government, I think, is making some difference in the uptake, which is great, and we just need to keep going. From the Public Health Agency perspective, we have been using many different approaches to combat vaccine hesitancy or boosting vaccine confidence, including providing different media formats, social media, videos on our website from experts in terms of answering questions that people have. So providing answers to the leading questions that the general public have is very important. But also providing support, including grants and contributions to communities, to community leaders, community organizations who are trusted by their communities in order to increase vaccine confidence is also really important. There's no one size fits all, and many different approaches are needed. The other thing is access. So working with Indigenous Services Canada, Indigenous organizations, many people on the ground, the provinces and territories, and local public health to increase the access, whether it be mobile clinics or other means, is extremely important still. Working with the business sector in terms of providing them with tools, information, that they can use for their employees is also really important, because they're going to have to answer questions from the employees as they put together the workplace requirements for vaccination, etc. So I think there are many different approaches. In terms of what things have worked, I remember there was a question a couple of weeks ago, maybe, on whether vaccine requirements work. And at that time, really, there's only empiric evidence and evidence from the application in other areas, such as school requirements for childhood vaccinations. But I do think that whether, I would say, together with other measures, these vaccine requirements in provinces seem to have nudged people to take up the vaccine. As I said, in Alberta, the first dose coverage went up by 4% just in the last while, which is tremendous. Just keep up the good work.
It's Dr. Njoo here. Maybe I can add underline a couple of points of what Dr. Tam said. So certainly when you're looking at the carrot approach, as Dr. Tam mentioned, we have something in the federal government called the Immunization Partnership Fund. And really it's a way to support, local communities, specialized communities in terms of the leadership that can reach with sort of unique ways their target audiences in a way that, let's say, medical officials like Dr. Tam, myself, can't at a national level. So that's very important. And we have certainly seen quite a range of very innovative approaches from these community leaders. The other thing I think we're doing that's, I think, been successful is looking at using what we call a segmented social marketing approach. And one of the target audiences I think we mentioned previously is sort of the young adult male population. So we've also worked closely with, quote, the gaming community, looking at the sort of leaders, role models in that community to also get the message across about how important it is to get vaccinated. And hopefully that's also having an impact. And finally, I would say that, in a positive way, I think things such as vaccine passports that I think, various governments in the provinces and territories have put in, I think have been effective because at the end of the day, I think it's about giving privileges to those who've made, I think, the right decision to get vaccinated so that they can undertake certain activities, go to a restaurant, to go to a sporting event and so on. Because I certainly, when I have gone into those establishments, I feel much more comfortable and safe knowing that everyone around me as well has taken the decision to get vaccinated. And we're all sort of not only protecting ourselves, but protecting each other. So I think with all of those range of tools, those are some of the ones that we're seeing are having a positive impact right now. Thank you.
Thank you, doctors. Follow up?
Yeah, I'm just wondering if you have modeling or have looked at research as expect to be the necessary level of vaccination to finally put an end to the pandemic. I know it's probably going to involve vaccinating people from 5 to 11, but I'm just wondering sort of what the target has to be.
Yes, it's Theresa Tam. So the Delta variant, of course, being more transmissible, has led to an increase in vaccine coverage level requirement to help move towards community immunity or herd immunity. So that's been the latest challenge, which means that you have to have very high vaccine coverage. But the vaccine coverage level required is also dependent on your local epidemiology. For example, how many people have had past infections, as well as the vaccine uptake, and also the contact dynamics of the population, whether you're densely populated or sparsely populated population, or whether you've got a congregate living or not so crowded living conditions. So the reproduction number, which you've heard in our modeling sessions, is how many people would a singular infected person with, say, the Delta variant infect, can vary in different contexts. So that's all to say is that this is not a static estimate, but can be different for different communities and populations across the world, but certainly even within Canada. We know that with a reproduction number of around 5 or 6, for instance, that you will need around over 80% vaccine coverage to move towards herd immunity or community immunity. So that is a particular target. That's the denominator of which is the total population, not the eligible population. So that is one parameter we can look at, but there needs to be an understanding more locally as to what that target might be. But all to say is, as I've said, go big, go as much as possible, reach for the stars, get to 100% if you could, even though that seems like a stretch goal. That's what you need to do with a very transmissible variant.
Thank you, Dr. Tam. Opérateur, prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Louis Blouin, Radio-Canada. Please go ahead. À vous la parole.
The question is for Dr. Tam, but Dr. Sharma, feel free to answer too. Government officials are putting together a mandatory vaccination model for public servants. Do you think it would be preferable to ask for proof of vaccination, that this mandatory requirement be paired with a request to give a proof of vaccination? Would you recommend it?
So if I understood the question correctly, it's about the vaccine requirement for the federal public service. Is that correct?
Yes. Yes.
Yes. So the Treasury Board and others are working hard at this, and there's a rapid implementation phase that we expect to happen. As the public health agency, we provide guidance, but the execution and operationalization is up to the employer. That they are now figuring out the instructions to staff in terms of providing, for example, attestation of their vaccination status. So all of that is still in the works, but I expect that there'll be implementation announcements pretty soon on exactly what employees need to do.
But don't you think that it would be more efficient if there was a proof of vaccination requested? I'm asking about maybe your expert advice on that.
Yes, there will be, I think, involved in this process a request for submission by staff of their vaccination status. If what you're talking about is should people show proof upon entry to different buildings, that is an operational requirement that I think needs to be sorted out by the departments. But I think the concept is that you need to make it operationally feasible. So I'm not the executor of that plan, but I'm sure there'll be different modalities also being explored for different work contexts, whether you're public facing or not, for example, in terms of your work, or whether you're working in a office setting with no interaction with the public. So it's a complicated program to roll out. And there will also have to be arrangement for testing, for example, for those who can't get a vaccine.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Kevin Gallagher, CTV National News. Please go ahead. À vous la parole.
Hello, my question is for Dr. Sharma, actually. So the United States and looks like Health Canada is looking at this treatment developed by Merck for COVID that seems to reduce hospitalizations. I'm wondering, there's a rolling approval now for Health Canada, but is there any expectation as to when that approval could be finished, or what this type of treatment could mean for the current situation facing many provinces dealing with a fourth wave?
Sure, thank you. So I think you're referring to the molnupiravir, which is a medication that's given within 5 days of the onset of symptoms. And there's been some clinical trials that have shown that it's been very successful in preventing disease. So Health Canada received that submission for molnupiravir on August 13th. And we're actually working with some of our international counterparts going through the review of that. The US FDA has yet to receive a formal submission, and they're expected to get it shortly, as well as the European Medicines Agency. So we are looking at it. Certainly we're going through, as we said, the data. It does take some months to go through that, so we don't have a specific time for completion of that. But it'll be held to the standards of all of our reviews. And just to note that that's actually going through our regular review process. So it's not the interim order process. It is the review that we would do for all medications or treatments. But we've also incorporated the rolling submission process there so that companies can give us individual and additional information as it becomes available. So we are working on it. Again, we're working on it collaboratively with our international partners, and we'll authorize it if it meets the standards.
Thank you. Follow up? Oh, nice. Yes, I'd like to follow up on the Johnson & Johnson vaccine. There are some provinces that are requesting more supply, and I'm just wondering, perhaps there's a question here for Dr. Sharma, but also maybe a question for Dr. Tam. There seems to be a need to try and use the Johnson & Johnson one-shot vaccine for people who are still unvaccinated or those who have hesitancy towards the mRNA vaccines. Number one, there was an initial problem with some of the approval for the production facilities of some of these Johnson & Johnson vaccines. Canada currently doesn't have any stockpiled, but we're going to look for some. How soon could Canada get a hold of the required Johnson & Johnson? And is this strategy, it seems, by the provinces something that public health, approves of? Is it a good idea to try and combat vaccine hesitancy by using a different vaccine?
Sure, maybe I could start on the regulatory side of things, and then I'll turn it over to Theresa and Howard. So the Johnson & Johnson or the Janssen vaccine is authorized for use in Canada. So it can be used. Again, it's right at this point in time, it is authorized as a one-dose vaccine. There have been some studies that have come out to show that there is added benefit from a second dose of the J&J vaccine to help boost immunity. And in some countries, they've already started to boost with a second dose, either of the J&J vaccine or in some countries like France with the mRNA vaccines. The supply situation is that it has regulatory approval. There are a number of different sites that do the manufacturing or the distribution or the packaging that are authorized. There are some sites that still have some issues around quality and quality manufacturing. So we would only allow the importation of Janssen vaccine that actually would meet all of those criteria. So we wanted to make sure that the level of safety and the effectiveness of the vaccine meets what was authorized. So we really would make sure that whatever was procured, the appropriate regulatory reviews of all of those sites that were involved in the manufacture and the distribution of the vaccine were up to par and up to standards, and then it would be allowed in the country. But in terms of the sort of supply and the use, maybe I'll turn that back over to Theresa.
Thank you, Dr. Sharma. So there has been some very recent discussions at the Special Advisory Committee with the other Chief Medical Officer. Given some provinces have an interest in accessing some J&J or Janssen vaccine doses in this last mile of trying to get their populations vaccinated, I just want to reiterate that the mRNA vaccines are safe and effective. The viral vector vaccines also includes the AstraZeneca vaccine and the Janssen vaccine. As Dr. Sharma said, that the Johnson & Johnson vaccine may benefit from a second dose. So I think for individuals who are thinking about this as a one-dose vaccine, more information is likely to be forthcoming in the near future on that. The National Advisory Committee is also examining the need for additional vaccines, including for individuals who've actually had a viral vector vaccine such as Janssen. So we expect more to come from that committee as well on this front. Having said that, a number of chief medical officers have indicated that, well, it's better than not vaccinating certain individuals if that is the only vaccine that is accepted by certain populations. So with that principle in mind, we are trying to get some doses as fast as possible. I think one thing that we need from the provinces is a good estimation of the amount that is required. We do not want to waste any vaccines that can help other countries in the world. And so that is an ongoing exercise right now in terms of the outreach. And we're waiting for provinces to get back to us on that front.
Thank you, doctors. We'll now move to the next question. Opérateur.
Thank you. Merci. The next question is from La prochaine question est de Catherine Lévesque, La Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Tout d'abord, je voulais peut-être entendre Dr. Njoo en français sur ce que Mme Tam vient de dire à l'effet que vous tentez d'avoir des doses de Johnson & Johnson. Je me demandais d'où est-ce que ces doses viendraient et puis est-ce que vous avez donné peut-être une date limite aux provinces pour qu'elles vous reviennent avec un nombre exact de doses demandées?
OK, merci pour la question. Peut-être je peux aussi faire une sommaire de ce que Dr. Sharma a dit. On est en train actuellement d'avoir des discussions avec nos homologues des provinces et territoires concernant peut-être la demande pour le vaccin de Johnson & Johnson, le Janssen, le vaccin. Mais comme Dr. Sharma a dit, de côté de perspective réglementaire, on veut toujours assurer que n'importe quel vaccin qui rentre au Canada et aussi passe les normes de Santé Canada pour la sécurité et aussi l'efficacité. Donc, je pense qu'on a eu des défis avec un établissement de production aux États-Unis, mais je pense qu'avec la compagnie, il y a plusieurs sources. Il y a toujours le potentiel de recevoir les sources de peut-être des autres établissements. Donc, ça, c'est quelque chose à côté. Mais avec les provinces et territoires, comme Dr. Tam a constaté, c'est toujours vraiment une question pour les provinces, les territoires à répondre à nous parce que c'est sûr, peut-être qu'il y a un segment de la population dans chaque province et territoire, peut-être qui était plus à l'aise peut-être de recevoir le vaccin Janssen pour peut-être une gamme de raisons. Mais on veut toujours assurer que la population sache que les vaccins, le Pfizer BioNTech, qui s'appelle maintenant Comirnaty, et aussi de Moderna, de Spikevax, sont toujours très efficaces et aussi très sécuritaires. Donc, ce n'est pas de question pour ça. Mais si on a assez de demandes et on est en train de discuter encore avec nos homologues pour une demande, et c'est vraiment important de préciser exactement le nombre de doses demandées par chaque province et territoire, parce que si on fait une commande de part de tout le pays, on veut assurer aussi qu'on peut utiliser tous les doses de n'importe quel vaccin ici au Canada et pas gaspiller, parce que c'est sûr, il y a une demande partout dans le monde et on veut assurer que vraiment c'est un vaccin qu'on va utiliser au Canada. Mais je pense que vraiment pour donner, en fin de compte, c'est toujours, je pense que si on veut vraiment vacciner le plus grand nombre de Canadiens possible, et on a déjà toute une sélection des vaccins approuvés ici au Canada, si vraiment il y a une demande des provinces et territoires, c'est sûr on va réagir pour remplir la demande. Merci.
Merci. Question suivie?
Oui, tout à fait. Je voulais aussi vous entendre en français sur un autre sujet, Monsieur Dr. Njoo. Je voulais savoir à quand peut-on s'attendre à une soumission de Pfizer pour les 5 à 11 ans pour vacciner les enfants? Et je voulais savoir, ça prendrait combien de temps pour que Santé Canada donne son approbation?
OK, merci. Je pense que Dr. Sharma peut-être aussi peut répondre, mais on a discuté sûrement comme les collègues. Et à date, on n'a pas reçu une soumission des compagnies Pfizer ni Moderna pour le vaccin pour les enfants de 5 à 11 que vous avez constaté. Mais je pense qu'on attend parce qu'on sait que les compagnies sont en train de continuer, peut-être même finir les essais cliniques. Il y a aussi des données probantes qui font partie d'une soumission, mais on attend avec hâte les soumissions. Et après avoir reçu une soumission de n'importe quelle compagnie, c'est sûr que nos collègues de Santé Canada vont travailler très, très, très fort et très vite aussi pour approuver, mais c'est toujours important de ne pas, comme on dit, couper, je ne sais pas en français, mais en English, cut corners. Et ils font toujours faire leur propre révision de toutes les données probantes avant de rendre une décision pour l'approbation. Je ne peux pas donner une date pour ça, mais c'est sûr qu'il y a beaucoup de personnel qui sont prêts à travailler jour et nuit après comme le reçu de la soumission de n'importe quelle compagnie. Je ne sais pas, est-ce que Dr. Sharma, est-ce que vous voulez ajouter quelque chose, peut-être en anglais ou en français?
Oui. Oui, donc les questions portent à la soumission pour les jeunes 5 à 11 ans. Maybe I'll do this in English. So the question was just around when we're expecting the submission from specifically Pfizer for children for the COVID-19 vaccine for those 5 to 11. And what we've heard from Pfizer is there's two parts of it. One is the clinical trial data. So the clinical trials have been completed for that age group, and they've submitted that, or they've given that clinical trial data to the United States FDA, but they haven't given them a formal submission yet. We're expecting that clinical trial data to come to Canada as well early next week, and then they'll file a submission with the US FDA, and then shortly thereafter they'll file a submission with us at Health Canada, and we're expecting that to come in likely before the middle of October. But they have noted that they'll give us some clinical trial data in advance so we can start working on that. This is a rolling submission, although it is not coming through our interim order process, so that equivalent to the emergency use authorization is coming through our usual vaccine authorization, so the way that we would look at all vaccines in Canada. We have a dedicated team that's ready to receive that information and review it as soon as it is available, and we would only authorize it if it was shown that the benefits outweighed the risks, specifically for this group of individuals from 5 to 11. And the other thing that I just wanted to mention is that we'll be dealing with a different formulation. So it's a different dose in this younger age group. It's a lower dose compared to that of the adults. And there are some differences in the formulation as well. So it's not just the clinical trials and how effective and safe the vaccine is, but we'll also be looking at this other formulation. And it really depends on the data, how long that review will take. And as soon as we have a chance to receive that and take a look at that, we'll be better placed to give people an idea of how long that might take.
Merci beaucoup, Dr. Sharma. Opérateur, prochaine question. Next question.
Thank you. Merci. The next question is from, la prochaine question est de Elizabeth Thompson, CBC News. Please go ahead. À vous la parole.
Yes, thank you very much for taking my question. You've mentioned vaccine passports, and we're seeing increasingly that everyone from businesses and provinces to employers are requiring proof of vaccination. But we recently did an investigation. We discovered that there are a lot of fake vaccination certificates that are being offered for sale online. So I was wondering if I could get your reaction to the fact that there are people out there selling replicas of certificates to people who don't want to get vaccinated, and what the government plans to do about it.
Yes, I can't speak to the role of the province and the territories, but certainly this is a issue that we're well aware of for the international border, for example. So we're always trying to be vigilant towards any fraudulent certificates. And when we do spot them, we emphasize that there are big penalties to submitting false information to the Government of Canada as it pertains to our border requirements, so that enforcement can be done after that. If there's a serious breach of government rules, if you break them, and that pertains to the international border. Of course, provinces will have their own mitigation measures, but it is an issue that we're all aware of. Now, on top of that, of course, we're working with the provinces and territories to look at the standards, to look at how vaccine proof, electronic vaccine proof included, can be standardized and be presented in formats and ways that are verified by or credentialed by the provinces, and in the future, credentialing by the federal government for international travel, which we have to work with other countries. So it is a matter of both provincial, federal, but also the international level as well. But there are consequences from a federal perspective.
Thank you. Follow-up question?
Yes, follow-up is, when you look at the sites, they're not only offering Canadian credentials, they're also offering cards from the CDC, from the NHS, from places around the world. Is there any move afoot to try to have an international database or an international proof of vaccination? Because these guys are also suggesting that they are able to input the fake data into official government databases.
Yes, I'm not the expert in this area, but I know that we've been working very hard in the international level with other partners and the WHO, other countries, including the G7, G20, and others, on the proof of vaccination for international travel. So all of that is actually in the works, and part of that will be on this credentialing approach in order to for mutual recognition, but also build into that certain features which to minimize fraudulent copies or fraudulent attempts at replication. But I'm sure is a big issue that must be part of the path going forwards. But I think it may be a question that we will take back to other government departments as well, because I think there are ways that other departments can deal with sites which are essentially providing these false certificates. And I think every country needs to examine the tools of which it can de-escalate or shut down such sites and practices.
Thank you.
Thank you. Thank you, Doctor. For our next question.
Thank you. Merci. The next question is from La prochaine question est de Zach Vachera, Saskatoon Star Phoenix. Please go ahead. À vous la parole.
Thank you very much for taking my question. I have a question that I suppose for Dr. Tam, and I suppose others could weigh in. Dr. Sakib Jahab, the Chief Medical Health Officer in Saskatchewan, said recently that the province is bound for a fall and winter of misery, is the way he put it, postulating or projecting that our very high case numbers are not likely to go down until perhaps Christmas or even beyond that point. I wonder what federal modeling says about that. Is it indeed true that provinces with very high case counts like Saskatchewan, Alberta, can expect potentially another winter of lockdowns or very, very high case counts?
Yes, I'll start on the answer to that question. I think the bottom line is depends on what we do. Depends on what happens in that particular province. You can bend the curve, and we know how, but these measures have to be taken. So, for example, the number one thing we've been stressing is rapid escalation of vaccine coverage. That will modify your trajectory in terms of the Delta wave and how many people get into ICUs and hospitals, because these vaccines are very effective at preventing serious outcomes. But vaccines take 6 weeks to go from first to second dose and wait 14 days at the minimum. So they are not the fastest tools to use to suppress a current wave. but they will help to dampen the wave going forwards, or the whatever epidemiology and up and downs in the different jurisdictions. Vaccines are going to help. And we said that in our last federal modeling session, that getting that gap in vaccine coverage for the young adults will help in shaping the epidemic curve to come. So things can be done. But if you need to curb the current resurgence, you have to reapply some public health measures, because that's the fastest way to suppress the transmission by reducing contacts while the vaccine coverage is being elevated. Otherwise, there is a risk for overrun of the healthcare system. So you need both at the moment, but we know that the curve can be bent. At the national level, as I said at the beginning, we are seeing that curve bending as we speak and plateauing across many parts of the country, and a slowing down in Alberta in terms of cases, not yet in the ICUs and hospitalizations, but it can be done. It's not an inevitable trajectory. So I think the most useful parts of showing models, for example, is so that you can actually do something about it and change your course.
Yeah, it's Dr. Njoo here. Maybe I just add to that, just to what Dr. Tam has said with respect to modeling in Saskatchewan. We continue to be in close contact with our counterparts, and I can say personally, I've had several conversations, discussions with Dr. Shahab regarding the Saskatchewan situation, and I think we're both agreed on one point, as we're all with the other medical officers of health across the country, and that is vaccination coverage is so important. And if you look at the statistics, I think Saskatchewan, compared to the other provinces and territories, still has some ground to make up. Dr. Shahab recognizes the challenges in certain communities in terms of the uptake of vaccine, both for first and second doses. They're making progress. I think the rates are increasing, but that really is the heart of it. And so from a federal perspective, any tools, any way we could help support Saskatchewan with increasing that vaccine coverage, I think, would be helpful to them. But as Dr. Tam says as well, obviously they take some time to be effective. And in the here and now, obviously with the strain on their healthcare capacity, we're also looking at other ways of supporting at the current time. But I think Dr. Shahab and public health colleagues across the country, as well as the healthcare system, we recognize it's a critical time right now. And if there's ways to reach maybe some of the community leaders in some of those communities that have maybe lower vaccination rates, we're certainly open to further discussions, looking at all sorts of tools and other supports that we can do, can put forward to obviously increase the overall objective, increasing vaccine coverage. Thank you.
Thank you. Follow-up question?
Yes. Again, for Dr. Tam and perhaps Dr. Sharma as well, and others can weigh in. Premier Scott Moe in Saskatchewan has said that he would very much like to see an expansion of the use of monoclonal antibodies in Saskatchewan. He actually said that he'd like to see it used in Canada and in Saskatchewan in the way that that therapy is used in the United States. I know Health Canada has approved, I think, 3 courses of treatment that are related to those antibodies. But I was wondering, Dr. Tam, if you could help clarify what the clinical evidence is around those treatments, how useful are they, and how much will they help in a situation like what we see in Saskatchewan today?
Yes, maybe I'll start, and if Dr. Sharma has anything to add, she will do so after this. So there are several different types of monoclonal antibodies that have been authorized for use, as you've said. It is up to clinicians and clinical practice to apply the use. And one of the difficulties, I think, with monoclonal antibodies is that some of them have to be given quite early on in the clinical course and intravenously, which is quite difficult to apply in the clinical context. But it can be worked out on the ground in terms of how clinicians can use them. And we've been monitoring, of course, together with the regulator, the effectiveness of monoclonal antibodies against the virus that is changing. And so, they do have varied effectiveness, but they're an added tool when you have patients, particularly in the high-risk categories. And so I think continuing to work and facilitate, I think, the sharing of best practices, including clinical practice between provinces, is something that we can certainly support. But ultimately, it is a matter of the people providing the treatment who come down with the guidance that is required for the use. So that might be part of it. And the interest in the Merck antiviral is because of ease of use, and you can give it up to 5 days in the start of someone's clinical course. So you have a bit of time, and then can be applied orally to someone, for example, with some moderate symptoms, mild to moderate. It can be more feasibly done. So there are lots of different factors at play, I think, as to why the uptake of monoclonals might not be as high in certain areas of the country or of the world. But we're certainly here to support provinces in terms of trying to access supply, as long as they can provide us with an estimate of how much that requirement would be by consulting with their own clinicians.
Thank you very much.
Maybe
go ahead.
Thanks, Eric. So I'll just add a couple of things. I think with the monoclonal antibodies, it is a treatment. It's used primarily in two groups of patients. One is people who have either mild to moderate disease and to prevent them from getting very sick, or you have people that are in hospital that are quite ill and they haven't mounted their own antibody response. So you're actually giving them the antibodies that their body would either provide or make naturally, or potentially they would get from vaccines. One of the challenges with monoclonal antibodies is that they are also a bit vulnerable to new variants that come up. So they may not necessarily be all that effective against, some are not that effective against the Delta variant, for example. So from the Health Canada perspective, when we look at the regulatory reviews, we look at the data, we look at the clinical trials, and then in that authorization, we summarize how they can be used. So what are the most appropriate ways that they would be used? What are the indications? What populations? If there are potential adverse events to look out for, all of that as well. And then it really is up to the clinical groups to decide for an individual patient whether or not that's something that is useful. So there are a number that are already authorized. We have other ones that are also under review as well, but it's really providing those in the armamentarium for clinicians to be able to use. And again, of course, the government of Canada has procured some of these monoclonal antibodies, which can be quite expensive. So they are also being provided to the provinces without additional charges. So it really depends on the clinical cases, and physicians will know their patients and their conditions and what variants they might be having more intimately than we would at the federal level, but really are doing everything that we can to make sure that at least they're authorized and they can be made available in Canada.
Yeah. It's Dr. Njoo. Maybe I would just add a final point, as Dr. Sharma said. If you're looking at the procurement angle, certainly we always have ongoing discussions with our provincial and territorial officials with respect to the need and demand for these monoclonal antibodies, based obviously on sort of clinicians' demand for them. And we also, on behalf of Canada, we actually are having very active discussions with the companies so that we can in real time and make sure that we can sort of fit the demand with the need and then make the appropriate orders on behalf of Canada, and obviously get them out to the provinces and territories as they're needed. Thank you.
Thank you, doctors. We have time for one last question. Dernière question, opérateur.
Thank you. Merci. The last question is from La dernière question est de Laura Oshman, the Canadian Press. Please go ahead. À vous la parole.
Thank you. My first question is for Dr. Sharma, to pick up on what you were saying about the process for the children's Pfizer vaccine. I was hoping you could just sort of explain the difference between the rolling approvals and the interim order, because many people have the impression that if it's approved under the interim order, it's a less thorough investigation of the safety of the vaccine. Can you just talk a little bit about the difference and what it means for the safety and efficacy of the dose?
Right. So the pediatric submission will actually not be coming in through the interim order. The interim order is really something we put in place to give us regulatory flexibilities. If we really look at the safety and the efficacy data that we look at and the quality data that we look at, really there's no difference between what we looked at and we needed for authorization under the interim order and what we look for through the regular process, which is called a new drug submission. So I just wanted to reassure people that whether or not it was coming through the interim order process or the regular review, we were holding those vaccines to the same high standards as we always would. And really what it did is that it gave us some regulatory flexibilities. So we had talked before about the rolling submissions so that companies could provide information as it becomes available rather than waiting till everything is complete to give it to Health Canada. There were provisions in the interim order for something called pre-positioning, so you could bring product into Canada before an authorization, for example. So what we've done is that for all the COVID-19, whether it's vaccines or medications, we've taken the parts of that interim order process that we found useful, such as the rolling submission, and we've brought them into our regular review. So we're looking at the same data, we're holding them to the same standards, we have the same dedicated teams that are looking at them, and again, really making sure that they overall meet the evidence bars for safety, for efficacy so that they do what they're supposed to do, and for quality to make sure that those vaccines, the millionth vaccine that comes off that line is exactly the same as the first, and to make sure that all the information on how to use the vaccines are available as well. So really, no difference.
Thanks, Dr. Sharma. I also wanted to ask about the flu in Canada. The first flu report came out today, and it showed higher than expected incidence of some respiratory viruses. This could be the first year where we have a major flu season and COVID-19. Aside from the usual sort of personal hygiene things, how does public health handle that, and how are emergency rooms and hospitals expected to handle that as well? What are you expecting?
Yes, so as you said, this could be the first season or the return of the other respiratory infections since the start of the pandemic, because we hardly had any of the other viruses last year. And we're beginning to see some of the usual respiratory viruses returning, including respiratory syncytial virus or RSV, which can be quite severe in younger children. So pediatricians, pediatric hospitals and others have been preparing for potential incursions of more than one virus. So that's something that they are preparing for sure. But I think by maintaining some of these routine hygienic measures, including not sending sick children to schools or daycares, for example, could certainly help, and all the measures that we've learned over the course of this pandemic can help. The other thing that I mentioned in my opening remarks is keeping up with routine vaccines. Some of the viruses, but can also be prevented through immunization, such as measles, for example. We really need to keep up and make sure we haven't lapsed in vaccination for those viruses, which can cause severe outcomes as well. And so all of that needs to be in place. And then we will be starting our influenza vaccine campaign. And yeah, but the very young and the very old are usually most impacted. So that would be really important for the younger kids who may be susceptible to influenza, having not seen influenza in the last season. They'll be more susceptible to the return of influenza. So I think those are some of the preparations that can be done. And then the overarching systemic changes could involve things like improved ventilation, and in our indoor spaces, that can keep away the other respiratory illnesses as well. And so there's lots that we've learned that we can apply to minimize the severe outcomes of the other viruses. We are tracking influenza virus activity across the world and across the Northern Hemisphere. Right now, we're not really seeing much. RSV is the virus that we're seeing, which is higher than the usual expected levels. And that needs to be managed and watched very carefully because it can be severe, as I said.
Thank you, doctors. C'est ce qui met fin à la conférence de presse pour aujourd'hui. That will be all for today's press briefing. Thank you very much. Have a good day.